On March 23, 2010, President Obama signed the Patient Protection and Affordable Care Act into law, and it was a really big deal. This historic moment owes a lot to ASA members who have been advocating for health care reform for a very long time. So after all of that work, where does that leave us? This month's video will shed some light on how the newly passed health care reform bill will affect home and community-based services providers. How does the health care reform bill impact adult day services? First, it includes the Community First Choice option, which provides 6% increase in federal funding to states for home and community-based services that provide personal care. Also, the Money Follows the Person demonstration has been extended to 2016, and the residency eligibility was changed from 6 months to 3 months in a nursing home. Spousal Medicaid impoverishment for home and community-based services are also now the same as nursing home eligibility. 1915 I-waiver eligibility increases to 300% of SSI over a 5-year period, and states will receive additional funding for the expansion of Medicaid to 133%. The bill also expands aging and disability resource centers that will help improve access to services, including adult day. The Community Living Assistance and Supportive Services Act provision, or the CLASS Act, establishes a national insurance trust that in 5 years will pay for services like adult daycare, home health, and hospice services. And finally, demonstration projects will be created on transitional care and hospital readmissions that could involve adult day services. How does the health care reform bill impact home health? Home health will experience $39.4 billion in cuts from a 1% reduction in market basket for 2011 and no update in 2012, plus rebasing over 4 years beginning in 2014. It's important to remember that this does not include the 2.75% case mix adjustment in 2010. In 2010, home health will see a 2.2% market basket increase. Also, of major importance to rural home health providers, the health care reform bill will provide a 3% rural add-on. The bill also calls for a study on the impact of cuts on home health services and the development of a value-based purchasing system. The independents at home, transitional care, accountable care organizations, hospital readmission, and bundled payment demonstrations could all be opportunities for home health agencies to partner with primary care practices and receive an incentive payment for improved quality. The Center for Medicare and Medicaid Innovation would develop a home health chronic care management demonstration as well. Finally, the bill creates a nationwide program for federal and state background checks. How does the health care reform bill impact hospice? Hospice will see a $6.8 billion cut beginning in 2013, resulting from a 0.3% reduction in the market basket in 2013, and then a 1% cut for 7 years. This does not include the 4% cut over 7 years from the BNAF phase-out. Hospice will also be required to collect additional data, and physicians will be required to have a face-to-face examination of the patient before the 180-day recertification period expires. Like home health, hospice will also have value-based purchasing beginning in January 2016. The creation of the Hospice Concurrent Care Program is a 3-year demonstration that involves 15 hospices, and it allows home health agencies and hospice programs to combine services. Quality reporting for hospice will be instituted, and failure to report these measures will result in a 2% cut in 2014. This data on quality will be available for the public. Finally, the nationwide program for federal and state background checks will also apply to hospice programs. This information and much more is available on ASA's Health Reform Hub on asa.org. Also, if you need more help with any of these items, please don't hesitate to contact us.